COPD, chronic obstructive pulmonary disease, typically develops over years of exposure to irritants such as cigarette smoke, air pollution, occupational dust, and chemicals. These environmental factors trigger inflammation and damage to the airways and lung tissues, leading to progressive airflow limitation. The initial insult causes a recruitment of inflammatory cells, particularly neutrophils and macrophages, which release proteases and other mediators that contribute to tissue destruction and remodeling. Simultaneously, oxidative stress from inhaled pollutants further exacerbates inflammation and disrupts the balance of protease and antiprotease activity, accelerating tissue damage. Over time, this chronic inflammation and structure changes leads to airflow limitation, mucus hypersecretion, and air trapping characteristic features of COPD. The causes of airway obstruction include emphysema and chronic bronchitis. Emphysema is a lung disease causes destruction of the fragile walls and elastic fibers of the alveoli. Small airways collapse when exhale, impairing airflow out of the lungs. In chronic bronchitis, bronchial tubes became inflamed and narrowed, and lungs produce more mucus, which can further block the narrowed tubes. Now, the pathophysiology of COPD is a progressive lung condition characterized by persistent inflammation and airflow limitation. The primary drivers of COPD pathophysiology is chronic inflammation in the airways and lung tissues triggered by exposure to irritants like cigarette smoke, and this inflammation leads to swelling and narrowing of the airways, impeding the flow of air in and out of the lungs. Over time, prolonged inflammation results in structural changes in the airways known as airway remodeling, including thickening of the airway walls and increased mucus production. Currently, COPD involves damage to the alveoli, the small air sacs in the lungs responsible for oxygen exchange, and this damage causes a loss of lung elasticity and air space enlargement, a condition called emphysema, which further compromises lung functions. Additionally, COPD is characterized by increased mucus production, which can obstruct airway and predispose individuals to respiratory infections. Furthermore, exposure to environmental pollutants leads to oxidative stress in the lungs, exacerbating tissue damage and inflammation. Together, these pathological processes contribute to progressive decline in lung function observed in COPD patients, leading to debilitating symptoms and impaired quality of life. Now, COPD symptoms often don't appear until significant lung damage has occurred, and they usually worsen over time, particularly if smoking exposure continues. Signs and symptoms of COPD may include shortness of breath, especially during physical activities, wheezing, chest tightness, a chronic cough, frequent respiratory infections, dyspnea, chest discomfort, fatigue, lack of energy, weight loss, swelling in ankles, feet, or legs. The risk factors for COPD include exposure to tobacco smoke. The most significant risk factor for COPD is long term cigarette smoking. And then, second is people with asthma or respiratory infections. Asthma is a chronic inflammatory airway disease, may be a risk factor for developing COPD. Occupational exposure to dust and chemicals, like long term exposure to chemical fumes, vapors, and dust in the workplace, can irritate and inflame the lungs. Exposure to fumes from burning fuel in the developing world, people exposed to fumes from burning fuel for cooking and heating in poorly ventilated homes are at higher risk of developing COPD. The uncommon genetic disorder alpha 1 antitrypsin deficiency is the cause of some cases of COPD. Other genetic factors likely make certain smokers more susceptible to the disease. COPD can cause many complications, including respiratory infection. People with COPD are more likely to catch colds, the flu, and pneumonia. Any respiratory infection can make it much more difficult to breathe and could cause further damage to lung tissue. Second is heart problem. For reasons that are not fully understood, COPD can increase risk of heart diseases including heart attack. Third is lung cancer. People with COPD have at a higher risk of developing lung cancer. Fourth one is high blood pressure in lung arteries. COPD may cause high blood pressure in the arteries that bring blood to your lungs. Fifth one is depression. Difficulty breathing can keep you from doing activities that you enjoy, and dealing with serious illness can contribute to the development of depression. Now, here are some preventions you can take to help prevent complications associated with COPD, like quit smoking to help reduce the risk of heart diseases and lung cancer. Get an annual flu vaccination and regular vaccination against pneumococcal pneumonia to reduce risk or prevent some infections. Talk to doctor if you feel sad or helpless or think that you may be experiencing depression. Take medications as prescribed. Eat well for more energy. Now, the diagnosis for COPD are lung test function, chest X-ray, CT scan, arterial blood gas analysis. In function test, these tests measures the amount of air you can inhale and exhale and whether your lungs deliver enough oxygen to your blood. During the most common test called spirometry, you blow into a large tube connected to a small machine to measure how much air your lungs can hold